Globe and Mail analysis. Healthcare is Canada's prime job creator, and not only because of an aging population. Matt Lundy, economics editor, published 7 hours ago. During a challenging stretch for the Canadian economy, the labour market has been relying on one industry for the bulk of its job creation: healthcare. Since the end of 2023, employment in healthcare and social assistance has risen by 6.4%, or around 150,000 positions, according to payroll data from Statistics Canada. This is nearly double the expansion in all other industries, which have a net gain of roughly 86,000 positions combined over the same span. Trends in healthcare are largely similar to the United States, where hiring in healthcare has propped up otherwise sluggish job numbers. There's much to explain Canada's stagnant labour market of late. Tariffs imposed by the United States have walloped her key export sectors in Canada and put a chill on hiring plans. Even before the trade war, job vacancies were vanishing as the Bank of Canada used higher interest rates to slow the economy and douse inflation. And the size of the population is now in decline, owing to stricter immigration policies that have cooled growth in labour markets. In choppy economic environment, healthcare is something of an outlier and less exposed to the ebbs and flows of the business cycle. And like other Western countries, Canada is roughly getting older. Roughly 1/5 of the population is 65 and older, compared with 8% in the early 1970s. But it is recent job boom isn't solely a story of aging demographics. Policy decisions on improving access to childcare and shifting consumer spending patterns have played a key role too. Healthcare and social assistance are the care economy, or pharmaceutical. They're clearly influenced by a pharmacology, trends that are general cyclically of the economy. Healthcare and social assistance are the care economy. They're clearly influenced by different trends than the general cyclicity of the economy, said Bernard, senior economist at hiring site Indeed Canada. This sector really stands above others as an area that is adding a lot of jobs, when a lot of the rest of the economy has cooled off, he added. Over decades, healthcare has become a bigger chunk of the labour market. Around 14% of Canadians residents work in healthcare and social assistance, up from 8% to 1970s. Of late, these articles sound more like artificial intelligence written than a human written. Over decades, healthcare has become a bigger chunk of the labour market. Around 14% of Canadian residents work in healthcare and social assistance, up from 8% in the 1970s. Of late, the hiring binge is spread across virtually all facets of the healthcare system, including the offices of physicians and dentists, outpatient care centres, and home health services. General medical and surgical hospitals have added nearly 54,000 positions, an increase of 8.6% since the end of 2023, while nursing care facilities have added more than 10,000 employees. In broad industry data, StatsCan lumps healthcare and social assistance together. The latter group is a standout for job creation too. Employment in community food, housing, and emergency services has risen by 18.5%, or around 46,000 positions, since the end of 2023. Meantime, jobs at child services have surged 37%, more than 55,000 roles over the past 4 years, owing to the federal government's plan to create a more affordable and accessible spaces for childcare. A January report from the Canadian Centre for Policy Alternatives, a left-leaning think tank, found that targets for the creation of new childcare spaces are not being met, which suggests there's room for expansion and further job gains.